My dear students, this time is a very good time if we but know what to do with it. I am now come to the fag end of hematology and I shall be rushing through 5 classes in this session. The first one is Bernard and Glanzmann. These two can come as short notes. One is a Bernard-Solier syndrome. It is a rare autosomal recessive disorder in the absence of glycoprotein 1b. And this is essential for the addition of the platelets. Furthermore, you find that there can be aggregation of the platelets such as fibrinogen which are interfered with. This is a blood picture which shows giant platelets. Normally, a platelet is about only 1 to 2 microns. This is a RBC you can compare. But here, this is a giant platelet. The clinical features will be the patient can have purpuric spots or mucosal bleeding and easy bruising. RBCs and WBCs are normal and the patient will be having thrombocytopenia because such cells can be devoured by the spleen. Bleeding time is prolonged, platelet aggregation is impaired, and there is absence of glycoprotein 1b if you have to do the study. There is no satisfactory treatment, only thing it has to be prevented. This is Bernard-Solier syndrome. The next one is Glanzmann's thrombasthenia. This particular diagram, before any kind of a description, diagram matters. A blood vessel, endothelium, subendothelial collagen. And when there is an exposure, you find that there is a von Willebrand's factor that is getting exposed, to which you find that there can be, these are all platelets, the orange colored ones. There is a glycoprotein 1b. This is addition, and afterwards there is a cascade of events called as aggregation. Now this again is an autosomal recessive bleeding disorder. There is a defect in glycoprotein 2A and 2B and 3A. Look at this one over here. You find that this is the 3A over here and there will be a 2A in this region. So since these are defective, you find aggregation will be defective. RBCs and WBCs are normal and platelets are normal in number, but they are discrete and small. Platelet aggregation does not take place and that leads to the bleeding disorder. So defect in the bleeding time, clot retraction is reduced, platelet aggregation is absent. Again, no effective therapy. The key here is absence of glycoprotein 2B and 3A. That brings us to the end of class 33.